You're gonna sleep right after, huh? Of course you are.
While many Canadians relaxed over the holidays,
Not too much.
Joey Salmingo took his newborn to a crowded hospital with a fever.
It took an hour just to see a triage nurse.
Oh, I know.
And it was 7 more hours until Salmingo's son was admitted to a bed.
So as the hours just went by, obviously the frustration, the anger is setting in.
Patients across the country keep facing those kinds of hours-long waits. In Quebec, provincial data shows dozens of hospital ERs are overflowing. And the average waiting time on a stretcher hit 18 hours by Tuesday afternoon.
This is the worst the healthcare system has been ever. You know, we're seeing patients in stretchers laying there for days on end.
This nurse in Montreal says long waits are tied to ongoing staff shortages and pressure from the usual respiratory viruses, plus COVID as well.
COVID is rampant throughout the hospitals, throughout every unit.
At St. Michael's Hospital in Toronto, upwards of 10% of patients on the wards are COVID positive.
It's often COVID intersecting with other illnesses and making people sick enough to end up in hospital.
He says most patients falling seriously ill with either COVID or influenza are also people who didn't get the latest vaccines. Federal data shows only 15% of the population got an updated COVID shot this fall.
Our vaccination rates across most populations and age groups, and in particular in children, are lower than we have seen in the past.
Doctors say there's still plenty of time to get those updated shots. COVID is still circulating, and the flu season in much of eastern Canada isn't expected to peak for several weeks. That means a busy winter ahead, and the more Canadians who can stay out of hospital, the better. Lauren Pelly, CBC News, Toronto.